Measuring wrist flexion, patient will be seated, elbow on table, hand in the air. An alternative way of performing this measurement is simply having the patient's arm hanging off, or their hand hanging off the table, being able to perform full range of motion of both flexion and extension. But for this, we'll have her elbow on the table, hand in the air. So to measure wrist flexion, what we want to do is we want to first find the ulnar styloid, and that is the prominent bony landmark on the lateral aspect of the wrist. Just go distal to that, and there's a little notch, the triquetrum. So place the axis of your goniometer on the triquetrum, the movement arm on the lateral aspect of the fifth metacarpal, and the stationary arm on the lateral aspect of the ulna. So go ahead and perform wrist flexion for me, Rach. So here we are looking at 75, 76 degrees. An alternative way of measuring this is to have the axis on the capitate, the stationary arm between the ulna and the radius, and your movement arm on the lining up with the third metacarpal. Go ahead and perform wrist flexion, Rach. And it'll look something like this. So we're looking once again 75 degrees. It is important to note that both of these, they are done in the clinical setting, both of these measurements, ways of measuring, but they often provide different results. So whatever you do, make sure that you're consistent in your measurements. Wrist extension, patient seated with elbow on table, hand in the air. Also, you can have the patient with their arm on the table and the hand hanging off the table, still able to perform full flexion and extension. So with this, just like flexion, we are going to measure with the axis on the triquetrum, the movement arm on the lateral aspect of the fifth metacarpal, and the stationary arm on the lateral aspect of the ulna. Go ahead and pull that all the way back from your range. Follow that, and we are looking at 70 degrees of extension with this. The alternative method of measuring extension is similar to the one that we did with flexion, except instead of being on the dorsal side, we're going to be on the ventral side of the wrist. So the stationary arm is going to be between the ulna and the radius. The axis, so for the axis, what you want to do is you want to find the capitate. So bend your arm forward, wait for that lunate to pop up, find the capitate next to it, lean it on back, go opposite, place that axis on there, and then line up the movement arm with the third metacarpal. So go ahead and extend your wrist backwards. Thank you. And right here, we're looking at 75 degrees. Measuring wrist ulnar and radial deviation. Have the patient's hand on a flat surface. Have the goniometer axis on the capitate, stationary arm between the ulna and radius, and the movement arm lining up with the third metacarpal. Rachel, if you could perform ulnar deviation towards your pinky, please. And line that up with the third metacarpal, and here we see 40 degrees, 45 degrees. Now, if I was to line up this movement arm along the distal phalanx, we are more so looking at 50 degrees of deviation, which is clearly not the case. So that is why it's important to line it up with the third metacarpal instead of the finger itself. Okay, now Rachel, I'd like you to perform radial deviation towards your thumb, please, as far as you can go. And right here we are looking at 25 degrees of deviation.